Hello there. Welcome, everyone. Dr. Fedich here, Village Family Clinic Director here in Hackettstown, New Jersey. We'd like to answer some commonly asked questions here about different health conditions and things we do at this office. So we're going to talk about something today, probably affects a lot of people. So we're going to talk a little bit about arthritis here. So real simple, we got some models here, but real simple, when you have arthritis anywhere in the body, there's different types. There's osteotype arthritis, so osteoarthritis or degenerative arthritis, and there's inflammatory type arthritis. So they're two completely different ideas. Osteoarthritis is a normal arthritis we think of as we get older, people get arthritis. Inflammatory arthritis, rheumatoid, there's a bunch of different ones, but really what it comes down to, if there's two joints in the body, as we get older, those joints want to come closer together as they wear out and they start rubbing and it causes pain. So really the joint should be this far and it's getting closer together as we age. Inflammatory arthritis means there's actually inflammation in between those joints. So swelling gets in there from different sources and actually kind of pushes the joints away as the inflammation gets in the joint. So a common type like rheumatoid in the fingers when the knuckles are swollen up because of inflammation in there. So really arthritis anywhere in the body, whether it's a spine, knee, neck, elbow, it doesn't matter. The joints are getting too close together. But when people say that arthritis hurts, the arthritis doesn't hurt itself. It's not painful. It's only painful as it rubs. So a lot of times we'll look at an MRI or an X-ray and we'll see the joints are, just bone on bone, and the pain only started a couple weeks ago, but it took 20 years to go from here to here. Now it started rubbing it, now you're calling us. So that's really what's important to know. And the converse is also true too. So sometimes, like when a knee wears out, what'll commonly happen is the knee joint gets closer and closer, but the way we walk, a knee doesn't wear out this way. The inside of the knee will rub like this before the outside ever rubs. So sometimes we do a simple knee brace, that special osteoarthritis knee brace, that realigns or pushes the knee this way. So now we move and we don't rub anymore, but when it was moving this way, it's rubbing and bother you. So it's simple like that can stop rubbing. Same thing will happen in the spine. So we got the bones of vertebrae, nice space in between the disc, a nice space in there for the nerves. But as we get a little bit older, that space starts shrinking down a little bit. And you see this next model, it's just a little less height in there, a little less room there for the nerve. Now we're maybe 40, 50 years old. We probably don't even notice that. But as you start getting these further phases, these two here is phase 3 and 4, start seeing less and less space in there for the nerve. And that's when people often call us up for pain. It's really the arthritis has been there for a long time, but now it's starting to rub the nerve or rub something that you feel it. So they can rub together and cause the pain, or like in the spine, it'll often rub a nerve in there. So a lot of times people say, oh, you can't fix your arthritis, can't cure it, which is true. But if we do, like for the spine, for example, a lot of times we'll do traction or spinal decompression, where a computer-controlled traction device gently separates the spine a little bit. And we tell patients, of course, you're not going to look like this, and anybody tells you that's not telling you the truth. But if we can take just a little pressure off the nerve, you'll get a lot of relief. So I kind of tell people, it's kind of like my finger. My hand should be this far away. My finger doesn't know it's this close, but it knows it once it touches it. But the converse is also true as well. So if we get a little pressure off there, you don't feel that at all, even though, hey, it's supposed to be this far away, but you're just not rubbing anymore to feel better. As I said, like the knee braces, they're rubbing on the inside, and if a brace can just take that pressure off that joint so that you move and it doesn't rub, you're not going to feel any pain. So just a brief description of osteoarthritis is really the joints getting too close together and start rubbing, causing pain. Inflammatory type arthritis, like rheumatoid and others, are often inflammation in between the joints. There's going to be a really different treatment, really different issue. Those are treatable as well. The other types of arthritis, rheumatoid and things, really anti-inflammatories, anti-inflammatory diet, nutrition, acupuncture, those kind of things can help with that. Clearly different idea of how we treat that, but absolutely treatable as well. So I hope that answers you some good question about arthritis, and we'll talk to you soon. Any questions, give us a call, 908-813-8200.